about a new today we will talk about a new subject which is very important, it's vital for you in your clinical practice. What we call vasculitides or vasculitis. Vasculitis. The word came from vessels or vasculature, and the section ITIS is added to mean an inflammation of blood vessel wall. Vasculitis هو the inflammation of the vessel wall. Okay. These are pictures of different patients. And as you see, there is widespread purpuric rash here and here, which is due to vasculitis. Vasculitides constitute a spectrum of diseases characterized by inflammation and necrosis of blood vessels. طبعا البلاد فيزل هو طبعا البلاد فيزل وول يصير به infection or inflammation with resulting ischemia of those tissues supplied by the affected vessels. Any vessel is responsible for making the tissues or certain tissues vitals by giving them the blood, okay, which is very vital for their viability. That's why any thing that interfere with a blood supply will result in ischemia. يعني انتم تسمعون واحد صار عنده ischemia، ممكن الاسكيميا is due to مثلا thrombosis or embolism, which block the route of blood, okay, or an inflammation of a blood vessel wall, which is vasculitis, or something pressing the blood vessel wall from outside, okay. هاي كلها ممكن نسوي لنا ischemia. هنا الاسكيميا is due to an inflammation of blood vessel. We have a classification which is labeled in 1994, and this is classification يعني حقيقة يقسمونها إلى small vessel according to the the size of blood vessel. We have small vessels, we have medium-sized vessels, and we have large vessels. Okay. هاي pictures or diagrams. لاحظوا أنه عندنا small vessel vasculitis وأكو medium vessel vasculitis وعندنا large vessel vasculitis. Okay. وكل وحدة definition and the types of vasculitis. Okay. And here لا جاي تلاحظون انه large vessel vasculitis. لاحظوا ايش قد very nice حقيقة picture. عندنا تاكاياسوس. Example of large vessel vasculitis we have تاكاياسوس, arthritis and giant cell arthritis. Okay. عندنا medium size or medium vessel vasculitis. We have polyarthritis nodosa and Kawasaki, and we have small vessel vasculitis. Okay, small vessel vasculitis. The wide list of diseases حقيقة comes under the type of small vessel vasculitis. حقيقة هواية disorders. We have immune complex small vessel vasculitis immune mediated. The underlying pathology هو immune complex deposition like cryoglobulinemia, like IgA vasculitis, hydroxon purpura, or hypocomplementemic urticarial vasculitis. And we have ANCA-associated small vessel vasculitis like small microscopic polyangiitis and granulomatous with polyangiitis, vaginal granulomatosis or Church-Strauss syndrome. هسه احنا هنا الكلاسيفيكيشن حقيقه اعتقد هو مور ريلايبل كلاسيفيكيشن هو هذا اللي هسه راح نحكي لكم اياه. We have clinical classification of vasculitis. Clinical. Okay. اللي هو الكلاسيفيكيشن التصنيف السريري. We have purpuric disorders. Purpuric اللي يسوي لنا باربرا، البكتشر اللي شفتوها قبل شويه اللي يسوي لنا باربرا اللي هي يعني subcutaneous bleeding. الباربرا هو subcutaneous bleeding، والباربرا هي اسم جامع للماني types of subcutaneous bleeding like we have يعني petechiae اللي هي very small يعني the smallest type petechiae. سامعين petechial rash or petechial bleeding. Okay, هاي petechiae. And we have a plaque اللي هي المور يعني larger than petechiae. Okay. And we have ecchymosis اللي هو هم larger one. الايكيموسيس larger than petechiae. هاي كلها الباربريك disorders due to vasculitis. وعندنا هينوكشنال باربرا وعندنا leukocytic vasculitis. هاي الباربريك disorders. We have microscopic polyarteritis. اللي هي polyarteritis nodosa. And we have the third type اللي هو aortic type due to involvement of aorta اللي هي Takayasu disease. polyarteritis nodosa. طبعا in the polyarteritis nodosa the subclavian artery is spurred, is not involved in polyarteritis nodosa. إذن Takayasu disease اللي هو يكون aortic type. And we have pulmonary type due to involvement of lungs اللي هو two حقيقة disorders Wegener granulomatosis and Church-Strauss syndrome. Wegener granulomatosis and Church-Strauss syndrome. Now, راح نستيكم في short essay about or short talk about any type اللي هو giant cell arteritis and polymyalgia rheumatica. Giant cell arteritis also called temporal arteritis because of involvement of temporal artery or cranial arteritis, and this is the most common type of systemic vasculitis. Okay, هذا اللي هو temporal arteritis or giant cell arteritis اللي هو the most common one, especially involves branches of carotid artery of patients over the age of 50, often female patients. إذا واحدة female وجدتكم with headache. Okay, طبعا usually the headache is not responding to analgesia. It's very حقيقة very severe headache or pain. Okay, and we have scalp tenderness وvisual sometimes visual branches. ممكن تشوفونها بعينكم صراحة تجيكم صورة حلوة حقيقة. These patients have jaw claudication definitely because of يعني the blood supply of jaws هو blood vessels حقيقة هو temporal artery. Arthralgia, they have mononuclear blindness sometimes which is irreversible. That's why giant cell arteritis is حقيقة very important to be diagnosed earlier. Okay, 90% of patients have high ESR. Okay, high picture حقيقة لاحظوا the branch or territory of the temporal artery is prominent. لاحظوا والtemporal artery is evident حقيقة. إذن scalp tenderness, visual or visualized branch of temporal artery and headache which is not responding to analgesia. High here hallmark of the clinical presentations of giant cell arteritis. Okay, biopsy of a segment of temporal artery reveals characteristic findings of inflammation and destruction of internal elastic lamina with giant cells. هي هاي اللي يسموها احنا giant cell arteritis لانه giant cells بالبيوبسي. polymyalgia rheumatica هاي حقيقة هي entity which is sometimes confused or mixed with giant cell arthritis. هو نفس الحقيقة نفس التايب هو characterized by pain, stiffness of shoulders and hip girdles and proximal extremities. It's also associated with high ESR and anemia. إذا جتكم مريضة عمرها أكثر من 50 سنة and ESR is above 50 وجتكم with يقول لك pain in my shoulders or my hip areas, okay, will pain not responding to analgesia or poorly respond to analgesia. خلوا بالكم البوليميالجيا روماتيكا وانتم بالامكان تعطونا للبيشنت small dose of steroids. حقيقة such patients they immediately respond to short course of steroids. هاي حقيقة sometimes challenges يعني treatment ممكن من خلالها نعرف أنه these patients have polymyalgia rheumatica. Okay. Definitely the diagnosis is made on clinical grounds and rapid response to steroids. Okay. A giant cell arthritis treatment, corticosteroid treatment is obligatory because they significantly reduce the irreversible visual loss and other focal ischemic lesions. بالنسبة للgiant cell arthritis usually needs high dose of steroids for long time. Okay, while in the polymyalgia rheumatica, they usually it needs small dose of steroid and for large and for less period, and treatment should not be delayed, especially if there have already been episodes of visual loss or stroke. Usually, بالنسبة للبوليميالجيا rheumatica, usually we start with 10 to 15 milligram as a single dose in the morning, while in giant cell arthritis we need 60 to 100 milligram usually in divided doses. Okay, because of side effects of steroids, sometimes we may need to give them a supplement of calcium and vitamin D. As you know, the steroids is the main يعني drug that may result in osteoporosis. Okay. The drawback of these diseases هو remissions and relapse. يعني يصير عندهم remissions وبعدين ممكن يصير عندهم relapse. هاي بالنسبة للgiant cell arthritis and polymyalgia rheumatica. Takayasu arthritis is a large vessel disease that affects young female but can be seen in both male and female. Up to the age of 50, it is also known as pulseless disease. إذا التاكاياسو حفظوها عندنا كواساكي وتاكاياسو. T تاكاياسو هو pulseless disease that involves the aorta and its branch. Okay. طبعا البرانش سيربرال ممكن تكون براكيوسيفاليك، ممكن رينال، ميزنتريك، فيمورال، كورونري arteries. كلهم دول ممكن they can or involved in the pulseless disease or Takayasu. T حفظوا T هو large vessel vasculitis or pulseless disease. Stenosis of proximal aorta and its proximal branch is the most common findings. هذا هنا بالنسبة للأنجيوغرام حقيقة. لاحظوا it's very nice. narrowing or stenosis هذا الايورتيك ارش وهذا البرانش. اوكي حقيقه هذا هنا هم البيكتشر واضحه. اوكي because of involvement of large يعني branch of subclavian artery or aorta, there will be حقيقة patients with complaint of limb claudication, lightheadedness, malaise, fever, arthralgia. All are experienced by such patients. Delay, if there is delay يعني حقيقة طبعا usually there is delay in the diagnosis because most of patients are asymptomatic حقيقة. Okay. The diagnosis will be made with angiography and treatment includes chronic steroids. Some patients may respond to immunosuppressive drugs. ممكن نستخدم هنا الميثوتريكسيت and cyclophosphamide some patients require corrective vascular angiography or angioplasty. إذن الأوبشنز of treatment هو steroids، ممكن immunosuppressive drugs and ممكن surgery اللي هو angioplasty. Polyarthritis nodosa is a medium polyarthritis nodosa هو medium vessel vasculitis involving segmental necrotizing lesions. segmental يعني مو كل البلاد فيزل segmental عنده. often at arterial branch points يعني بالبرانش points. اوكي وين اكو برانش اكو bifurcation يصير عندنا هذا الاستينوسيس هنا. اوكي ممكن يصير استينوسيس، ممكن يكون thrombosis، ممكن يصير hemorrhage، ممكن يصير infarction. كل الاوبشنز or يعني possibilities will be يعني evident. Okay, we have classical polyarthritis nodosa is a rare condition which unlike other vasculitic diseases usually occurs in middle-aged men. هذا الكلاسيكال. It is accompanied by severe systemic manifestations and its occasional association with hepatitis B antigenemia suggests a vasculitis secondary to the deposition of immune complex. البوليارثرايتس نودوزا يعتبرونه immune complex or يعني immune mediated disease because of association with hepatitis B in certain people. Okay. هاي الكلينيكال بيكتشر اوف بيشنت. هاي الاسكيميا، لاحظوا الاسكيميا اللي تصير. لاحظوا هنا areas of pallor and areas of subcutaneous bleeding. لاحظوا يعني purpura and pallor. هذا القناة الصفراء هاي تعتبر pallor. Okay. Pathologically there is a fibrinoid necrosis لاحظوا of vessel walls with microaneurysms formation, microaneurysm, thrombosis and infarction. Okay, definitely there is fever, malaise, weight loss and myalgia. The initial symptoms are followed by dramatic acute features اللي هي due to an organ infarction. We have many manifestations according to the organ or system which is involved, like neurological, like mononeuritis multiplex, abdominal pain. If there is involvement of abdominal viscera, ممكن يكون حقيقة like or similar to acute or mimicking acute cholecystitis, pancreatitis, appendicitis, according to the organ which is involved. Renal will present with hematuria, proteinuria, hypertension, chronic renal failure. Cardiac, we have coronary arteritis due to myocardial infarction or may cause heart failure. Skin, there will be subcutaneous hemorrhage and gangrene. Lungs involvement is rare in the polyarthritis nodosa. We have investigations like blood count, anemia, leukocytosis, high ESR, biopsy, and angiography. There will be microaneurysms in hepatic, intestinal or renal vessels. قلنا microaneurysm يصير عندهم. Most patients are undiagnosed until post-operatively for ischemic events. ما يجي بالبال حقيقة، ما يجي بالبال هو البوليارثرايتس نودوزا، ما يجي بالبال. corticosteroids and immunosuppressive drugs. هذا الحقيقة the main options حقيقة. Sometimes the use of antiviral drugs in patients with positive serology for hepatitis B طبعا and C يعني ممكن يفيد البيشنتس. We have Church-Strauss syndrome which is known as allergic granulomatosis and angiitis, and this is a medium and small vessel vasculitis. يعني Church-Strauss ممكن نخليه ضمن الميديوم سايز وممكن نخليه ضمن ال small vessel vasculitis. and طبعا Church-Strauss syndrome حقيقه بفد صفه انه البرزنتيشن عندهم دول البيشنتس عندهم اكسترا فاسكولار مانيفستيشنز اللي هي كرونيك اسما. اوكي يصير عندهم يعني اتاكس اوف اسما. اوكي and in addition to eosinophilia in the blood film يعني اذا نسوي لهم كومبليت بلاد كاونت يطلع لهم ايزونوفيليا. اوكي ان برزنتيشن مالتهم لايك asthmatic patients نسوي لهم chest x-ray يطلع لهم pulmonary infiltrate يعني يطلع لهم فد pulmonary shadow or يعني opacity. اوكي اذا عندنا 3 presentations اللي هم asthma plus infiltrate lung infiltrates and eosinophilia. The vasculitis involve skin ممكن peripheral nerves GIT what other organs may be affected ممكن يعني any organ يعني مو هو حقيقة limited to lungs. Biopsy shows microgranuloma and eosinophilic deposits. The pulmonary infiltrates are patchy but rapidly resolved with steroid. إذا تعطيه steroid البيشنت رأسا هاي الانفلتريت تروح. Recent reports showed that anti-leukotriene drugs اللي هم montelukast, zafirlukast, branlukast اللي هم ذولا اللي يستخدمون in patients with asthma as a prophylactic حقيقة. هسه بالسوق موجود عندنا المونتليوكاست اوكي as a prophylactic for exercise induced asthma حقيقة يستخدموه in the exercise induced asthma. هذا ممكن يسوي لنا picture similar to Church-Strauss syndrome. Diagnosis نعتمد على clinical حقيقة suspicion plus biopsy okay and eosinophilia but the eosinophilia is not so highly elevated حقيقة. anti-neutrophil cytoplasmic autoantibodies اللي هي P اللي هي perinuclear ANCA are positive in most of such patients اللي هو autoimmune autoantibody اوكي. الانتي-neutrophil cytoplasmic autoantibody اللي هو perinuclear LP للperinuclear. Treatment is based on steroids and sometimes immunosuppressive drugs can be added. Okay. We have vaginal granulomatosis, also small and medium-sized or medium vessel vasculitis like Church-Strauss syndrome. وB 3 characteristic هنا هما involvement of lungs, involvement of sinuses, and involvement of kidneys. Okay. هنا الفيجنال هم يشبه الشيرش-ستروس syndrome. اوكي اللي هم sinuses, upper airways, lungs and kidneys. شوف لاحظوا معظم الفاسكولايتس هم عندهم skin manifestations. اوكي هاي البيكتشر هي حقيقة very nice picture. هذا البيشنت اللي هو عنده ابو الفيجنال granulomatosis because of involvement of sinuses. لاحظوا اكو deviation بالساينس or بالنيزل septum and as you see there is يعني eye congestions, conjunctival congestions because of involvement of sinuses طبعا and upper airways. Okay. And as you see the palate is يعني penetrated لاحظوا because of involvement of sinuses. Okay. هنا حقيقة very nice picture of diffuse purpuric spots, and this is a lateral view of a patient, and as you see there is a disfigured حقيقة nasal appearance because of involvement of septums. Okay. Sometimes there is يعني a delay in the diagnosis for months or years حقيقة. Sometimes the vaginal granulomatosis can be presented with alveolar hemorrhage and or rapidly progressive glomerulonephritis because as we said that the kidneys or kidneys or renal parenchyma can be involved with the progressive glomerulonephritis اللي هي progressive حقيقة glomerulonephritis. Most of them will end up with renal failure. Okay. And this is the morbidity حقيقة and mortality of this disease هو due to involvement of renal parenchyma. Okay. The diagnosis is based on tissue biopsy, serum tissue biopsy, and ANCA of C-type اللي هو cytoplasmic. هناك بالchurch-Strauss syndrome البerinuclear P ANCA and هنا الcytoplasmic ANCA هو was seen in 90% of patients with renal disease and 70% with without renal disease. إذا أكو renal disease راح نشوف الأنكا type, السي type of أنكا الأوتو أنتيبودي هو 90%, while in those without renal disease نشوفهم in only 70%. Mortality of untreated patients approach 100 حقيقة لازم نسوي لهم early diagnosis حقيقة because the fatality is high. Treatment is steroids, immunosuppressive drugs, combination immunosuppressive drugs and relapse is very common. Phenoxyrin purpurate, which is used of pediatric age group and due to involvement of small vessel and seen حقيقة in children in the adolescents حقيقة. Classical clinical triad of palpable purpura at buttocks حقيقة, arthritis and abdominal pain is found in 90% of patients. إذا يجيكم البيشنت عنده فد skin rash involving the posterior aspect of legs, thighs and buttocks حقيقة, the posterior aspect, وممكن يطلع على الانتيريور aspect هاي البربريك spots or particular rash. إذا شفت البيشنت واللي هو young وتسألونه عن الهيستوري of arthritis, تسألونه عن الهيستوري of abdominal pain. اوكي حقيقه هو clinical diagnosis. هذا disease هو clinical diagnosis. Fever, glomerulonephritis are also common. ممكن يجي البيشنت with glomerulonephritis. Affected vessels containing immunoglobulin and complement deposition and serum IgA is often elevated. نسوي لهم serum IgA. ال IgA deposition in renal lesions is characteristic. يعني إذا أنت تسوي البايوبسي راح تشوف ال IgA deposition. The diagnosis is confirmed depending on clinical and laboratory findings. Okay. هاي البيكتشر هو يعني هم مطلعين الانتيريور اسبكت هو اكثر شيء حقيقه بالبوستيريور and يعني spread upward to the buttocks. Sometimes يعني the patients with Heilongjian purpura may develop perforations, bowel perforation or significant renal disease. The majority حقيقة have a benign disease حقيقة, and يعني we diagnosed a lot of patients with Heilongjian purpura. Unfortunately, all of them improved. Only one, I remember, one patient حقيقة is still complaining, or she, Naya, she's still complaining of remissions and relapses حقيقة of these skin lesions. Okay. The differential diagnosis هو drug-induced purpura and SLE, gonococcal arthralgia, keratoderma pneumologica, and secondary syphilis. Treatment supported with non-steroidal anti-inflammatory drugs and analgesia. Steroids kept for more symptomatic patients. Those with chronic renal disease require steroids and immunosuppressive drugs. هاي بالنسبة patients with Heilongjian purpura حقيقة معظمهم يستجيبون only to steroids. إذا صار عندهم renal involvement تستخدم لهم immunosuppressive drugs. Okay. هاي picture هم different pictures حقيقة. لاحظوا هاي واصلة للstage of gangrene. لاحظوا هاي حقيقة suppurative involvement. هاي pictures. Okay. لاحظوا هاي كلها types or كلها examples of vasculitis. هذا شوف لاحظوا يعني كأنما بيرن حقيقة. هنا شوف صاير عنده gangrene هذا due to يعني total obstruction of the يعني blood vessel wall. لاحظوا هذا كله due to vasculitis. Okay. حقيقة pictures هواية. لاحظوا كلها due to vasculitis. Okay. هاي يعني اعتقد كمان الموضوع. اذا الفاسكولايتس يا شباب خلوا الفاسكولايتس in any chronic undiagnosed or يعني vague patients with vague symptoms. Any patient with a skin lesion خلوا ببالكم الفاسكولايتس. any patient with purpura or subcutaneous bleeding خلوا بالكم الفاسكولايتس. Okay, الفاسكولايتس is حقيقة present everywhere and should be suspected in every patient with skin lesions. شكرا جزيلا.